discuss a very important and interesting topic, that is the anterior triangle of the neck. Now, before starting with the anterior triangle of the neck, I'll give a brief introduction about the neck, where exactly the neck is situated, okay, what is the shape, then what are the different type of structures present over there, okay, and along with that, how the divisions of the neck are done in order to study it easily. Okay, so in anterior triangle of the neck, as I said, first you have to understand the basic structure. For that, a brief introduction of the neck is required. Okay, along with that, I have mentioned some points. Okay, so I'll be explaining about the anterior triangle of the neck under these headings. Okay. Now, at least 2 classes are required in order to complete the anterior triangle of the neck. Okay, and I have mentioned these points. I hope you remember last week when we have discussed about the face. In the same way, I have mentioned the point. Based on that, I have completed the face. In the similar way, I will start with the anterior triangle. Now, I hope you have seen the posterior triangle in dissection hall. Okay, or you have seen the diagrams. I think sir have started with the posterior triangle. Okay, please be attentive in the class. Then only you will come to know. I know sir have started with the posterior triangle. All the boundaries and all those things were discussed. Okay, now don't worry. Today I will be giving you an overview of both the triangles. Okay, and then straight away I will go to the anterior triangle. Okay, now these are the points. As I said, under these points, under these headings only, we'll discuss about the anterior triangle. Now, in the dissection, if you have seen the cadaver, just focus on the neck portion of the cadaver. You will see that it is a bridge between the head and the rest of the body. So, the neck which is present, it is a bridge between the head and the rest of the body. Now, exactly from where to where it is located. Now, this particular part, the neck is situated in between the mandible and the clavicle. Okay, between these 2 bones, the entire neck is situated. Okay, now it is connecting the head directly to the torso, and it contains numerous vital structures. Okay, so numerous vital structures are present in this neck region. As you will dissect, okay, and you will go to the interior part of the neck, at that time we will come to know what are the important vital structures present in the neck. Okay, now the anatomy of the neck is very complex and very intricate, okay, because so many structures are placed over there. For example, the structures which are present, they are responsible for breathing, they are responsible for speaking, then swallowing, regulation of metabolism, support and connection of the brain and cervical spine, circulatory, lymphatic inflow, outflow from the head. Okay, so these are some important functions. So the structures which are present in the neck, they support those functions of our body, which are very important. Okay. Next, in neck, you will see some of the important structures. For example, proximal part of the esophagus, some part of the trachea, thyroid gland, along with that parathyroid glands are also present. Okay. Next, some important blood vessels. For example, jugular veins are there. Along with that, carotid arteries enclosed in carotid sheath. And along with that, you will also see some important cranial nerves present over there. Along with that, some skeletal muscles are also present. Okay, as I have mentioned over here, as you can see. Okay. Next, so in a small area, so many structures are placed. Okay. Now, in order to study that particular area and in order to understand the structures, what we have done, we have divided the neck into two parts. Okay, and for that a particular muscle is responsible, and the name of the muscle is sternocleidomastoid muscle. Okay, as I said, so many structures are there in the neck performing various functions, very important functions. Okay, now when you will study the neck at a whole, you can't study the neck. For that, what we have to do, we have to divide it into small portion. If we divide it into small portion, then in that particular area, what are the structures present, we can study it easily. That's why what is done, the entire neck is mainly divided into two triangles, that is anterior triangle and posterior triangle. And that division is done by a very important muscle, that is sternocleidomastoid muscle. Okay, so the sternocleidomastoid muscle transects the side of the neck and it is placed obliquely. Okay, it is placed obliquely. We'll discuss about the sternocleidomastoid muscle also in detail. Okay, on each side, and divides the neck into anterior and posterior cervical triangle. Okay, so once we divide the neck into anterior and posterior triangle, then it will be easier for us to understand the structures present in the neck. Once we have divided, okay, now for example, two classrooms are there. Okay, so during the time of exam, what we do, we divide the students. Half student will sit here, half student will go over there. So like this, it's easy for us to control. It's easy for us to understand how the students are writing in the exam. Okay, this is an example. In the similar way, so many structures are present in the neck. बहुत सारा structures है. Okay, now as a whole, we can't study. So for that, what we have done, we have divided it into two triangles. And that division, how it is done? Now, whenever you are dividing, you need a partition. Okay, for example, that wall is the partition. Okay, so similarly, a partition is required, and that is given in the form of sternocleidomastoid muscle, which is present obliquely in the neck. Okay, now this is dividing the neck into two triangles, anterior triangle and posterior triangle. Now the structures are situated in the anterior triangle, structures are situated in the posterior triangle. Okay. Next part, do you remember every time whenever any triangle comes, we have to define the boundary of the triangle? If you remember, in our body, if there is any triangle, कोई भी triangle हो, then what we have to do? We have to define the boundary of that particular triangle. So similarly, the anterior triangle and the posterior triangle, first we have to define the boundaries of the triangle. Okay, once we have defined the boundaries of the triangle, then we'll see the contents of the triangle. If you remember the femoral triangle, the most easy one, when you have studied the lower limb, okay, at that time also you have defined the boundaries of the triangle, then you have seen the contents of the triangle. Similarly, here also we will do the same thing. Now, here you can see the diagram. In this diagram, both the triangles can be seen. Okay, so this is a lateral view of the neck. Okay, so like this, a lateral view is taken. Now, from this lateral view, you can see both the triangles. Okay, so which muscle is this? Anyone? Yes, this is the sternocleidomastoid muscle. Okay, as I said, we will be discussing about the sternocleidomastoid muscle in detail. Origin, insertion, nerve supply, action, everything. Okay, and with the action, what are the movements taking place? We'll discuss. Okay, but first try to understand that this entire neck portion is divided into two triangles. Okay, so this is the anterior triangle and this is the posterior triangle, and in between both the triangles you can see a muscle is placed, that is the sternocleidomastoid muscle, and it is not straight. Okay, it is placed obliquely in the neck. So in front of that, which triangle is this? This is the anterior triangle and this is the posterior triangle. Okay. Now anterior triangle in the neck is a large triangular space. Okay. It is a large triangular space on each side of the neck in front of the sternocleidomastoid muscle. Now in this particular triangle, can you see where the apex is situated? Apex is situated downwards. If you see this particular triangle, in a triangle, I hope you know what is the apex and what is the base. So in this particular triangle, the apex is situated downwards and this is the base of the triangle. Okay, now this anterior triangle is a large triangular space. Okay, the space is large. So that's why what happens? It got further division. Okay, that means further it is subdivided into smaller triangles, so that the specific structures, whatever are present, it can also be classified. Okay. Now here, this is a beautiful diagram. In this diagram also you can see both the triangle. You can see the anterior triangle also. You can see the posterior triangle also. Okay. So see, this is the anterior triangle and this is the posterior triangle. And here the sternocleidomastoid muscle is situated. Now you have to understand the boundary of the anterior triangle. Okay. Now, so this is the base of the anterior triangle. Okay. So if you see the base, it is formed by the lateral border of the body of the mandible. Okay, and the imaginary line extending up to the mastoid process. Next, anteriorly there will be a anterior median line. Okay, the anterior median line. The anterior median line is extending from the symphysis menti from the suprasternal notch. This is the anterior median line, which is situated anteriorly. Next, if you go posteriorly, then you can see the anterior border of the sternocleidomastoid muscle is there. Okay, so this is the base, this is the anterior border, this is the posterior border, and this is the apex. How the apex is formed? The apex is formed by the anterior median line, okay, and the anterior border of the sternocleidomastoid where they are joining. That will form the apex. Okay, so this is the boundary of anterior triangle. Okay. Now in the boundary, as I said, anteriorly anterior median line of the neck is there. Now posteriorly anterior border of the sternocleidomastoid muscle. Just now I have shown you in the diagram. Okay, base, how it will be formed? Lower border of the body of the mandible and a line extending from the angle of the mandible to the mastoid process. Okay, this is the mastoid process of the temporal bone. When you will study the temporal bone, at that time you will come to know about the mastoid process, thyroid process. Okay, apex at the suprasternal notch, the meeting point between the anterior border and the anterior median line. Now roof, okay, so roof is also there. Now in this particular case, when we will go further, at that time you will see roof is also there, floor is also there of that particular triangle. Now in this case, the roof is formed by investing layer of deep cervical fascia. Okay, investing layer of deep cervical fascia. So in the neck fascia, this investing layer of deep cervical fascia is very important. Okay, I hope you have studied about this. If not, you will be studying about the cervical fascia also. So this investing layer of deep cervical fascia is forming the roof. Okay. Now the superficial fascia, which is present just below the skin, I am talking about the anterior triangle. In that you are getting one muscle that is called platysma. Have you heard about it? Platysma muscle, yes. So the platysma muscle is present over there, and along with that you are getting some nerves. For example, cervical branch of the facial nerve. That day we have discussed about the terminal branches of the facial nerve, and that time I have mentioned about the cervical branch of the facial nerve. Okay. Along with that, we are also getting the ascending, descending branches of the transverse cervical nerve. These are for cutaneous innervation of the anterolateral portion of the skin of the neck. Okay, so those nerves are also situated in the roof of the anterior triangle. Okay, so this is the complete boundary of the anterior triangle. Now, I hope you have seen in the diagram that the anterior triangle is large area. Okay, and inside the anterior triangle also so many structures are present. Now, in order to make it more easy, okay, so entire triangle so many structure, that means it is very complex. Now, in order to make it easier, more, or you can say another subdivisions are done. Okay, so smaller subdivisions are done of the anterior triangle, so that each and every subdivision is also a triangle, and inside that triangle what are the contents present. Like this, if we study, then it will be easier for us to understand the entire anterior triangle. Okay, now for that two muscles are there which are helping in division, in making the subdivisions of the anterior triangle. Okay, so for convenience of the description, the anterior triangle is being subdivided by two muscles. What are they? Digastric muscle and omohyoid muscle. I know you have not heard about these muscles, okay, but as we go further, I will show you the muscles, I will show you the origin, insertion, action, okay, everything about these muscles. Okay, so जो anterior triangle है, the anterior triangle is a large space. Now what we have done, we have divided it into smaller division so that it will become easy for us to understand the anterior triangle. So how we will do the division? For the two muscles are responsible. What are those muscles? Digastric muscle and omohyoid muscle. Okay, so in this point also, I hope you have seen, I have mentioned about the digastric muscle and omohyoid muscle, because these are the key muscle in this particular region. Okay, and they are dividing the anterior triangle into smaller subdivisions. Okay, now what are those subdivisions? As you can see, submental triangle. Okay, now these two muscles are subdividing or dividing the anterior triangle into smaller 3/2 triangles. Okay, what are these? Submental triangle, half portion, then digastric triangle, also called as submandibular triangle, then carotid triangle and muscular triangle. Okay, so these are the subdivisions of which triangle? Anterior triangle. Is it clear, everyone? See, a large space is there. Okay, inside the large space, so many objects are kept. Okay? Imagine a large space is there, triangular space. Inside that, so many objects are placed. Now you have to segregate those objects and place it properly. Okay, it will be difficult if you don't make the partition. So a large triangular space, what you have done? You have done some partition, and in each and every partition you have kept some objects according to your convenience, so that whenever is required, you will go and you will pick the object. Okay, take the example of your shelf, bookshelf, or take the example of your cupboard. Okay, उसमें shelf होता है, huge space is there, so many shelves are there. In each and every shelf you keep whatever you want. Whenever it is required, you just pick it. Easy for you. So similarly, जो anterior triangle is a large space, so many structures are there. So for our convenience, what we have done, we have made in small divisions, subdivisions. So in that subdivision, these structures are present. Easy to understand, easy to identify. Okay. So what are the subdivisions? Submental triangle, digastric triangle, carotid triangle, and muscular triangle. Now, as I mentioned earlier, any triangle in our body, what we have to do? We have to define the boundaries of the triangle. कोई भी triangle है, you have to know about the boundary. And along with that, if a triangle is there, triangular space, that means it will be having some contents. Okay, so you have to know about the content. So if you understand this concept, anterior triangle will become very easy, or else it will become very difficult. Okay, you can study any book. Now here you can see the subdivisions of the anterior triangle. Can you see the anterior triangle? Can you locate the anterior triangle, everyone? Last bench. Can you locate the anterior triangle? Stop writing. I know few students are writing practical. Please stop doing that inside the classroom. You are not allowed to write all those things. Now here you can see sorry, this entire part is the anterior triangle. Okay, so as I said, two key muscles are there. What are those two key muscles? Digastric and omohyoid. So here you can see this is the digastric muscle. Okay, and here you can see this is the omohyoid. Now here only one part of the omohyoid muscle can be seen. Okay, other part is not seen because it is having two bellies, superior belly and inferior belly. Okay, now these two muscles, okay, are dividing this large area into small triangular spaces, various triangular spaces. So first you can see this is the digastric triangle. Okay, see this is the digastric triangle. Then this large area, this is the carotid triangle. Then this particular area, this is the muscular triangle. And this small area, okay, one half area, this is the submental triangle. Okay. Now, when we'll go to the boundaries of each and every triangle, then you will be having an idea that each and every triangle, it is made up of which structures and how the boundaries are defined. Okay, so my aim, why I have shown you this diagram, so that you can see all the subdivisions of anterior triangle, right? So you can see the digastric triangle, you can see the submental triangle, then muscular triangle, and this is the carotid triangle. So we'll start one by one. As we go from one triangle to another, okay, things will get clear. Now here also you can see the triangles of the neck. So which triangle is this? Digastric triangle. See, this is the digastric triangle. Now how is this? Here we will be getting the submental triangle, here muscular triangle, and this particular part, this is the carotid triangle. Okay. So these are the subdivisions of anterior triangle. Okay. Now, as I said, two key muscles are there. What are those two key muscles? Digastric muscle and omohyoid muscle. Okay. Now, there are some unique feature of these two muscles. Okay. Now, what are that particular unique feature of these two muscles? Now, here you can see the diagram. Okay. In this diagram, which muscle is shown? Digastric muscle is shown. Okay. So, I know you have not studied about the mandible till now, but with the help of the diagram, I hope you can understand the digastric muscle. So, the digastric muscle is having two bellies, as you can see in the diagram, anterior belly and posterior belly. Okay. See, this is the anterior belly of the digastric muscle, and this is the posterior belly of the digastric muscle. Now, both the bellies will come, okay, and it will form an intermediate tendon. That is the attachment. So from here, attachment, anterior attachment, posterior attachment. Okay, then they are coming, forming the intermediate tendon. And that intermediate tendon is anchored in the hyoid bone. You can see, it is anchored in the hyoid bone by a fascial sling. See, this is the fascial sling. And that is derived from the investing layer of deep cervical fascia. Okay. So this is the digastric muscle. So this is the origin, digastric fossa of the mandible. So this is the mandible muscle. This part is cut so that you can see the entire muscle. Okay. So this is the anterior belly, and posterior origin you can see mastoid process of the temporal bone. Okay, this one. Okay, everyone, you can feel a bony area, hard bony area over here, just behind the lobule of the ear. So this is the lobule of the ear. ठीक है, ठीक इसके पीछे you can feel a hard bony area. This is the mastoid process. Okay, this is the mastoid process of which bone? Temporal bone. So from there the origin is taking place. Okay, to see mastoid notch of the temporal bone. From there the posterior belly is arising, and it is joining where? In the intermediate tendon. And intermediate tendon is anchored by a fascial sling. Hyoid bone. Okay, so this is the digastric muscle. Another muscle is there. What is the name of that muscle? Omohyoid muscle. Omohyoid muscle. Okay. Now the omohyoid muscle, same like the digastric, it is also having two bellies. But here these are superior belly and inferior belly. Okay. When you have studied the clavicle, I hope you have studied about this. Okay, when you have studied about the scapula, I hope you have studied about, you have heard about the omohyoid muscles, the attachments of the scapula. Okay, So it is also having two bellies. The inferior belly, see, it arises from the upper border of the scapula near the suprascapular notch. I know you have studied about the scapula. Okay, so near the suprascapular notch, the inferior belly arises. Okay, then it will pass behind the sternocleidomastoid and ends in the intermediate tendon. So it is also having intermediate tendon. Okay, next superior belly begins at the intermediate tendon and then it will pass almost vertically and it will attach to the lower border of the hyoid bone. Now here also the intermediate tendon is supported by a fascial sling, okay, in the clavicle by investing layer of deep cervical fascia. Okay, now this is a beautiful diagram of the some of the structures of anterior triangle of the neck. Okay, so if you are dissecting the anterior triangle very well, okay, so at that time you will be getting such kind of picture. Can you see the muscles? Here, can you see? I hope you can see the muscles. Okay, now these are also called as infrahyoid muscles. Okay, these are called as infrahyoid muscle. Among them, here you can see the omohyoid muscle. See, this is the omohyoid muscle. Okay, so this particular part of the omohyoid, this is the superior belly of the omohyoid muscle, and this particular part, this is the intermediate tendon. Okay, if you can focus over here, this is the superior belly of the omohyoid muscle. Okay, this is the intermediate tendon. Okay, after that you will be getting the inferior belly also. Okay, so if you are dissecting very well the anterior triangle of the neck, at that time you will be getting this particular picture. Okay, intentionally I have used this picture so that you will be having an idea that when we will dissect the anterior triangle of the neck, what exactly we can see. I am not telling that everything, all the structures are shown over here, mainly the infrahyoid muscles, beautifully, these are intact and it can be seen over here. Okay. So these are the two key muscles which divides the anterior triangle of the neck into 4 different subdivisions. Okay, among them which one is the first? First is the submental triangle. Okay, now this submental triangle, it is a median triangle in front of the neck, just below the chin. Okay, this particular part, okay, just below the chin. This is the submental triangle. Okay, and it is present on either side, below the chin and above the hyoid bone. So that is the part for the submental triangle. Okay, now if you see the submental triangle, on each side you will be getting anterior belly of the digastric muscle. Okay, so digastric muscle is coming like this and then going, I have shown you in the diagram. So on each side, both the sides, you will be getting the anterior belly of the digastric muscle. Base will be formed by the hyoid bone. Okay, apex is formed by the chin or the symphysis menti. This is the submental triangle. So whenever you will be studying about the triangle, I will request everyone to please see the diagram. Once you see the diagram, okay, how the triangle is formed, it will be easier for you to understand. Okay. Next, here we are having both floor also and roof also. Floor is muscular in this case and it is formed by the mylohyoid muscle. Okay, it is formed by the mylohyoid muscle emitting the median fibrous raphe. Now this median fibrous raphe is the part of pharynx where the constrictor muscle arises. Okay, and the roof is formed by the investing layer of deep cervical fascia. Now here you can see the diagram. Can you identify the boundary? In case of submental triangle, as I said, how the boundaries are formed. Now here on each side you are getting the anterior belly of the digastric muscle. Okay, each side, ऐसे digastric muscle रहेगा. Apex, how it is formed? It is formed by the chin or the symphysis menti. ठीक है? And what about the base? How the base is formed? By the hyoid bone. Okay, so this is the submental triangle. Now on the submental triangle, so once you have defined the boundaries of the triangle, and next what about the floor of the triangle? As I said, the floor is muscular in nature. Here one muscle is present particularly which is forming the floor, it is the mylohyoid muscle. Okay, yeah, so here you can see this is the anterior belly of the digastric muscle. This is the anterior belly of the digastric muscle on both the sides. Okay, next you can see the base is formed by the hyoid bone, and you can see this is the apex which is formed by the chin or the symphysis mentae. Okay. Next, can you see the floor? This is the floor. This particular part is the floor. This particular part is the floor. Okay. Now in the floor, what you are getting? You are getting one muscle, that is the mylohyoid muscle. And in the midline, can you see a green color line is drawn? Actually, green color नहीं रहता है. For your understanding, the green color is used. That is the median fibrous raphe. When you will study the pharynx में 3 groups of constrictor muscles are present. Okay. At that time, you will come to know about the median fibrous raphe. It's related to the pharynx. Okay. So that is present. So once you have defined the boundary, now see, if you know the diagram, it's very easy to define the boundary. Just see the diagram. If you know the diagram, easily you can write the boundaries from the diagram. Next, what do you think? What will be the content? So in submental triangle, the contents are very simple. It's not that difficult. As you can see, submental lymph nodes are there. These are the submental lymph nodes which are present, and along with that, submental veins are present, and there will be commencement of the anterior jugular veins. Okay, see the commencement of the anterior jugular vein, both sides, right side and left side. Okay, so these are the contents of the submental triangle. Okay, now I am not going into the detail of the contents. As I have mentioned over here, great vessels of the neck. When we discuss the great vessels of the neck, at that time all the blood vessels will be covered. Okay, all the arteries, all the veins will be covered that time. Okay. Next is the digastric triangle. Okay, now the digastric triangle, first of all, why it is called as digastric triangle? Because the triangular area is placed in between the 2 bellies of the digastric muscle. That's why it is also called as digastric triangle. Okay, so digastric triangle, submental triangle kahan pe rahega? Where I have shown here you will be getting the submental triangle. Okay. Now what about the digastric triangle? Go laterally, posterolaterally. Okay, in this particular area you will be getting the digastric triangle. Okay, now you have to define the boundary. During the time of exam, you can't say here I am giving digastric triangle, here I am giving submental triangle. No, you have to particularly define the boundary. Now the digastric triangle is the area between the body of the mandible and the hyoid bone. Okay, and it is also called as the submandibular region. Now the structures of this region in the submental triangle and in the digastric triangle is lying in the submental and digastric triangle. Now it is also called as digastric triangle. Why? Because it is located between the 2 bellies of the digastric muscle. Okay, and the base is formed by the mandible. That's why it is called as the digastric triangle. Now here also the boundaries are there. Okay, now here you can see anterior inferior boundary and posterior inferior boundary. So anterior inferiorly we are getting the anterior belly of the digastric, posterior inferiorly posterior belly of the digastric muscle. Now posterior inferiorly, along with the posterior belly, another small muscle is there, and that is called as stylohyoid muscle. It is coming from the styloid process of the temporal bone. Okay, so these are the anterior inferior and posterior inferior boundary. Next, the triangle is there, that means apex will be there, base will be there. Now in this case, base is formed by the base of the mandible and the imaginary line joining the angle of the mandible to the mastoid process. Okay, that is the base. Apex, how it will be formed? Now apex is formed by the intermediate tendon of the digastric muscle. Okay, the intermediate tendon, anterior belly, posterior belly, the intermediate tendon, that is forming the apex of the digastric triangle. Okay. Next, this triangle is also having floor and roof. So floor is formed by the muscles. What are those muscles? Mylohyoid muscle, hyoglossus muscle, and middle constrictor. The middle constrictor is a part of pharynx. And roof is formed by the investing layer of deep cervical fascia. Now here you can see the diagram. This is the diagram showing the boundaries of the digastric triangle. So this is the boundary which is present anterior-inferiorly. This is present posteriorly. Okay, so see here we are getting the anterior belly of the digastric muscle. Here we are getting the posterior belly of the digastric muscle, and this is the base. This is the base. Okay, so this is the base of the mandible, and this is the imaginary line extending up to the mastoid process, from the angle to the mastoid process. Okay, and where is the apex? Can you see the apex over here? So see here, this is the anterior inferior, this is the posterior superior boundary, this is the base. What about the apex? This is the apex. Okay, the intermediate tendon. Okay, where it is meeting, this is the apex. Okay, so this is the anterior inferior, posterior inferior boundary, this is the base, and here you can see this is the apex. Okay, now what about the floor? Where is the floor? Can you see the floor of this triangle? Yes, this is the floor of the triangle. This particular area is the floor of the triangle. Now in the floor of the triangle you can see three muscles are present, mainly mylohyoid muscle, hyoglossus muscle, and middle constrictor. Some part of the middle constrictor of the pharynx, that is forming the floor. So here also the floor is muscular in nature, and roof will be formed by investing layer of deep cervical fascia. Okay, so that is about the digastric triangle. Okay, next, so digastric triangle is there. Now here you have to know one thing: the digastric triangle is divided into two parts. Okay, the digastric triangle is divided into two parts with the help of a ligament that is called stylomandibular ligament. Can you see a green line over here? Sorry, so not green, this pink line over here. So this is the styloid process. Okay, so the stylomandibular ligament is coming from here. Now stylomandibular ligament will extend from the tip of the styloid process to the angle of the mandible. Actually it is not a ligament which you have studied in case of bones, okay, or joints. This is a modification, or you can say condensation of investing layer of deep cervical fascia. Okay, now this particular stylomandibular ligament, what it does, it divides the digastric triangle into anterior division and posterior division. Okay, so this particular part will be the anterior division, and this particular part will be the posterior division. So the posterior division of the digastric triangle is, or will continue with the carotid region. Okay, I hope you have dissected the carotid region. Okay, so this posterior part of the digastric triangle is continuing with the carotid region. Okay. Now the digastric triangle, as I said, it is subdivided into anterior and posterior part by a ligament that is called as stylomandibular ligament. Okay. Now which extend from the tip of the styloid process to the angle of the mandible. That is the extent of the stylomandibular ligament. Now this division will help to divide the contents also. So contents present in the anterior division, contents present in the posterior division of the digastric triangle. Okay. Now as I said, the posterior part of the triangle is continuous above with the carotid region. Now this digastric triangle is having numerous structures, that also important structures, and here you can see the list of the structures present. Okay, so what are the contents? First you can see submandibular salivary gland, very important structure present in the digastric triangle. Okay, so we have discussed about the microscopic structure of submandibular salivary gland also, if you remember last week. Next, so lymph nodes are also there, then hypoglossal nerve, or also called as the 12th cranial nerve, then facial artery, facial vein, not entire facial artery, facial vein, some part of the facial artery, facial vein is present, then submental artery, mylohyoid nerves and vessels. These are the structures present in the digastric triangle. Now the posterior part of the triangle, okay, lower part of the carotid gland. Okay, so if you see the posterior part of the triangle, some part of the carotid gland is there, overlapping the posterior value of the digastric muscle. Then the most important one, that is the external carotid artery, is present over there. Then carotid sheath is present. Okay, it is a covering for the external carotid artery, internal carotid artery, and internal jugular vein. Along with that, the vagus nerve more deeply beneath the carotid gland and the styloid process. So these are the structures present at the posterior division of the digastric triangle. Now here you can see, now by looking at the diagram, can anyone tell me which is the anterior division and which is the posterior division of the digastric triangle? ये देखो, this is the anterior division of the digastric triangle. This is the boundary of digastric triangle. This is the boundary of digastric triangle. Okay. So this particular part is the anterior division of the digastric triangle. This is the posterior division of the digastric triangle. And as I said, the posterior division of the digastric triangle is continuing above with the carotid region. Okay. So like this, you have to segregate the contents also. Now in the anterior division, what are present? As you can see, what is this? Submandibular salivary gland. Okay. Next you can see these are the facial vessels, facial nerve, facial vein. Here you can see omohyoid nerves and vessels. Okay. Then hypoglossal nerve. So mostly, and this submandibular group of lymph nodes. So these are mainly situated where? In the anterior division of the digastric triangle. Now these structures are situated in the posterior division. Now here you can see the carotid arteries, you can see the internal jugular vein, okay, and more deep, it's not shown over here, but more deep you will be getting the vagus nerve also, okay. So in between these two structures here, the vagus nerve is placed, okay. So like this, these are the contents of digastric triangle in anterior division and posterior division. So how the division is done? Which ligament? Stylomandibular ligament. Okay, stylomandibular ligament, extending from the styloid process to the angle of the mandible. These are the points from which MCQs are asked. Okay, next is the carotid triangle. Okay, so the name suggests carotid triangle means what will be the contents? Mainly the carotid arteries. That's why it is also called as carotid triangle. Okay. So it is also called as carotid triangle because it contains all three carotid arteries. Now what are three carotid arteries? That is the common carotid artery, internal carotid artery and external carotid artery. These are the three carotid arteries present. So all the arteries present in one particular area. That's why the triangular space is called as carotid triangle. As simple as that. Now, though it is a triangle, again boundaries are there. Okay, so what are those boundaries? As you can see, superiorly we are getting the posterior belly of digastric muscle, and it is supplemented by stylohyoid. Inferiorly, superior belly of the omohyoid muscle, and posteriorly anterior border of the sternocleidomastoid muscle. Okay, here you can see roof. Again, it is formed by the investing layer of deep cervical fascia. Okay, and the floor is muscular. These are the muscles forming the floor: thyroid, hyoglossus, middle constrictor and inferior constrictor. Okay, these are the muscles which are forming the floor of the triangle. Okay, now let me show you the diagram so that the things will get clear. And as I said, once you know the diagram, then it's very easy to define the boundaries. Okay, only you have to be very careful with the contents. Yeah. So in this diagram, can you see the boundaries? Okay. So what is present superiorly? Yes. So this is the superior boundary. Therefore, this is the superior boundary. It is formed by which muscle? Posterior belly of the digastric muscle. Okay. Next, anterior inferiorly, what is present? Superior belly of omohyoid muscle. So I have shown you the omohyoid muscle. Two bellies are there: superior belly, inferior belly. Okay. So here you can see this is the superior belly of the omohyoid muscle, which is forming the anterior inferior boundary. Okay. After that, what is the posterior boundary? See, this is the posterior boundary. It is formed by sternocleidomastoid muscle. That means the anterior border of the sternocleidomastoid muscle. Okay. So this is the superior boundary, inferior boundary, posterior boundary. Next, you can see the floor. This is the floor. Okay. Now, what about the floor? How the floor is formed? It is muscular in nature. Okay. Now, in the floor, various muscles are present. For example, hyoglossus muscle is there, hyoid muscle is there, then middle and inferior constrictor. These are the muscles present in the floor. The floor is muscular in nature. And what about the roof? Investing layer of deep cervical fascia. Okay. So these are the boundaries of carotid triangle. Okay. Now What will be the contents? Any idea? Just now I mentioned 3 carotid arteries will be there, and always keep that in mind. The carotid arteries, they are enclosed in a facial covering. Okay, that is called as carotid sheath. Okay, we'll discuss about the carotid sheath. I think I have mentioned. See, I have mentioned carotid sheath. Okay, so gradually I am coming to all the points whatever I have mentioned. Now here you can see the list of the contents. So first of all, carotid arteries are there. So which carotid arteries are present? Common carotid artery, internal and external carotid arteries. Okay, so these are the 3 carotid arteries. Along with that, carotid sinus, carotid body, very important. Internal jugular vein, and last 3 cranial nerves. Okay, so what are those last 3 cranial nerves? Vagus nerve, spinal accessory nerve, and hypoglossal nerve. That means 10, 11, 12 cranial nerves are present. Last 3 cranial nerves. So we know that how many cranial nerves are there? 12 pairs of cranial nerves are there. तो उसमें last 3 कौन सा होगा? 10, 11 and 12. Okay. So what are those 10, 11, 12? Vagus, spinal accessory and hypoglossal. These last 3 cranial nerves. Okay, the terminal part, not the entire part. The terminal parts are present over here. Next, the carotid sheath. See the carotid sheath just outside, or you can say on the body of the carotid sheath, we are having a very important structure that is called ansa cervicalis. Anyone have you heard about this ansa cervicalis? Ansa cervicalis, actually it is a U-shaped loop of nerves, okay, derived from the ventral rami of C1, C2, C3. Okay, ventral rami of C1, C2, C3. What is the main function? And inferior branch of the hypoglossal nerve is also joined over here. The main function of the ansa cervicalis is to supply the muscles of the infrahyoid muscle. To supply the infrahyoid muscles. Okay, not all, most of the infrahyoid muscles. Next, the cervical part of the sympathetic chain and deep cervical lymph nodes. These are the overall contents of carotid triangle. Okay, now let me show you the diagram. Yes, here you can see the diagram. Okay, so see, these are the boundary of the carotid triangle. Now inside the boundary you can see the contents. So mainly what you can see, the carotid arteries. So what are the 3 carotid arteries are present? First is the external carotid artery, common carotid artery. Okay, then external carotid artery, internal carotid artery. ये देखो, this is the common carotid artery, then this is the external carotid artery, this is the internal carotid artery. Okay. Next, what you can see the internal jugular vein, and here you can see last 3 cranial nerves. Along with that, you can see the lymph nodes also. So mainly these are the structure. Now here I have not shown you the carotid sheath. Okay, so generally these structures are enclosed in a facial covering that is called as carotid sheath. From the beginning to the termination, means from the beginning to the part from which the artery enters the cranial cavity, entire part is covered by carotid sheath. Okay, and on the wall of the carotid sheath, the ansa cervicalis is also present. So when we will discuss the carotid sheath, at that time all the structures will be discussed separately. So that is about the contents of the carotid triangle. Here also you can see the contents. This is the outline of the carotid triangle. This you can see the structures. Now multiple branches are also there. Okay, those branches are mainly, I am talking about the arteries. Those branches are mainly the branches of the external carotid artery. Internal carotid artery in the neck region directly don't give any branches. Last triangle, that is the muscular triangle. Okay, now muscular triangle is a very simple triangle. Okay, and the contents are also very simple. Anteriorly, as you can see, anterior median line of the neck is anterior median line of the neck. Okay, from the hyoid bone to the sternum. Okay, here the anterior median line of the neck will be extending from the middle point of the hyoid to the sternum. That is the anterior median line of the neck, which is present anteriorly. Next, posterior superiorly and posterior inferiorly. Posterior superiorly, we are getting the superior valley of the omohyoid, and posterior inferiorly, we are getting the anterior border of the sternocleidomastoid muscle. Okay, floor again, the muscles are present, and here the muscles are nothing but the infrahyoid muscle. 4 muscles will be present over here. Okay, and the roof again investing layer of deep cervical fascia. Now here is the diagram. It's a very small triangle. Okay, can you see the outline of the muscular triangle? This one. See the outline of the muscular triangle. So first, anteriorly we are getting the anteromedian line of the neck. So this is the anteromedian line of the neck extending from the hyoid bone to the suprasternal notch of the sternum. Okay. Next, posterior superiorly, what we are getting? Omohyoid muscle. See, posterior superiorly we are getting the omohyoid muscle. Then posterior inferiorly what we are getting? Anterior border of the lower part of the sternocleidomastoid muscle. Okay, so like this the triangle is formed. Okay, now if you see the floor of the triangle, okay, if you see the floor of the triangle, as I said, it is completely muscular and it is formed by the infrahyoid muscle. Okay, 4 muscles will be present over there. Okay, roof is formed by investing layer of deep cervical fascia. Now contents in case of muscular triangle, 4 muscles are there. What are those? These are also called as infrahyoid muscle. Okay, so mostly the muscles which are present in the neck, okay, in the anterior triangle of the neck, if you exclude the floor which are forming the muscles which are forming the floor, mainly the muscles are divided into 2 groups: suprahyoid muscle and infrahyoid muscle. 4 suprahyoid muscle and 4 infrahyoid muscle. So total 8 muscles are there. Okay. Now what are the infrahyoid muscles? See, sternothyroid, omohyoid, sternohyoid and thyroid. These are the infrahyoid muscles. So mainly these are the contents. Wait outside. These are the contents of the muscular triangle. Okay. Along with that, some important structures are also present in this triangle. For example, some part of the thyroid gland, then trachea, esophagus. Okay, these are present. Now, these muscles, how they are oriented. Now, superficially, we are getting sternothyroid and omohyoid. These are superficially oriented. And deep, we will be getting the sternothyroid and thyroid. Okay, means when you will dissect at that time, superficially, we are getting 2 infrahyoid muscle. What are they? Sternohyoid and omohyoid. These are they superficially. Deep to that, again you will be getting 2 muscles. What are they? These are the sternothyroid and thyroid. Okay. Now here you can see the contents of the muscular triangle. Okay. Can you see the outline of the muscular triangle? This is the outline of the muscular triangle. And these are the contents of the muscular triangle. So mostly in the muscular triangle, what is present? The name muscular means muscles will be there. Which muscles are present in the muscular triangle? Infrahyoid muscles are there. How many infrahyoid muscles are present? 4 infrahyoid muscles are there. Okay, 2 superficial and 2 deep. Okay, so that is all about the contents of the muscular triangle. Okay, now let me show you the diagram. Yeah, this is a beautiful diagram showing the infrahyoid muscles. Okay, so 4 infrahyoid muscles can be seen. So what is the meaning of infrahyoid? Below the hyoid muscle. Okay, so those muscles, uska origin, insertion, those will be below the hyoid bone, as you can see in the diagram. Okay, so see, these are the 2 deep muscles, thyroid and sternothyroid. These are the deep muscles, and superficially you are getting these 2 muscles. This is omohyoid. This is the omohyoid having 2 bellies. This is the superior belly. This is the inferior belly. Okay, and this is the sternothyroid. Okay. Now, in the next class, we'll be discussing about the infrahyoid and suprahyoid muscle. Okay, mainly the name of the muscles already I have shown you. The origin, insertion, nerve supply, action, similar for the suprahyoid muscles also. Okay. Now, for example, here you can see the list of the infrahyoid muscle. So, attachment, nerve supply, action. Okay, and along with that, this is the suprahyoid muscles. Okay, these muscles are also important because they are having very important function, especially stabilizing the hyoid bone, helps in swallowing, helps in production of the speech also. Okay, so like these various important functions are there that we'll be discussing about the suprahyoid and infrahyoid muscle. Okay, so about the triangles, anterior triangle, subdivision, contents, boundaries, I hope it is clear. Now I will request everyone to study about the boundaries of the anterior triangles and their subdivision. Okay, it will be easier for you. Okay, after that if there is any doubt, you can ask. Okay, okay, thank you everyone.